Well, the holiday season can be a tough time for people who have lost loved ones or close friends. Some people suffer from broken heart syndrome. And this morning, WWL-TV medical correspondent Dr. Corey Hebert is with us explaining that. But first, while I have your ear, I want to talk to you about the oyster situation right now. There are oysters out of Galveston, Texas that are getting people sick in Texas and Louisiana. And you can actually confirm you do know someone who's gotten sick in Louisiana.
Yep, very recently from consumption of oysters. So folks, you know, we eat a lot of oysters, but if you're going to eat them out there now, make sure that they are fried or charbroiled and boiling in that little shell, because if you're not, then you're putting yourself at risk for possibly hepatitis, possibly several other little parasites. So please just be careful out there.
Yeah, that's so scary.
Yeah.
Okay, so let's get back to broken heart syndrome. A lot of people say, oh, this isn't real, it's fake, but it's 100% true.
Yeah, and I bring this up every year around the holiday times because broken heart syndrome kind of comes from the fact that when you are really upset about something, when you have a really big argument, and during the holidays, man, we have family members that cause us a lot of stress and pain in these like Christmas days and Thanksgiving. So please make sure if you start having unexplained chest pain and shortness of breath after an argument. It can also be after you really hurt yourself, right? Like if you break a bone or something. But if you actually have this chest pain, call 911 first, okay? Then actually get to the hospital. But it's something that's reversible. Okay, so I don't want people to freak out like it's irreversible, like a heart attack, but it affects the way the heart is pumping the blood, so it feels like a heart attack. It's really, really important. So we all have that right now.
So that's what the symptom is. Okay.
Yeah, and we all have that a little bit because Sheba's leaving.
That's what I was just going to say.
You know, we're all going to have a little broken heart syndrome.
Oh my gosh.
However,
Yes.
we got to remember. Look at Eric. Eric thinks that's funny. See what I'm saying? So.
He's going to be crying like a baby.
I know. But really, that's a real serious situation. So please don't poo-poo it away, because the issue is you could be actually having a heart attack, and if you're having a heart attack, obviously that could lead to your demise. But just calm down over the holidays. Make sure you don't get into these big arguments with folks over the food, especially if you're eating a lot of high salt and eating a lot of drinking a lot of caffeine. That triggers all of this stuff.
All right. What about the truth about over-the-counter sleep aids?
Yeah.
You got some bad news for people who need that to go to sleep?
I want to throw this out there because I think people get confused about these things. So a lot of people take like this Advil PM, Tylenol PM, Unisom gel, and all these types of things. But please, I want you to understand that those medicines are just that particular medicine with Benadryl. All right? So it's literally Benadryl plus Motrin, or Benadryl plus Aleve, or Benadryl plus Tylenol. So you got to remember, if you just want to go to sleep, I'm not recommending that you take Benadryl, but please don't just take the medicine Advil PM when all you need to be taking is the Benadryl if that's what you're trying to accomplish. Like I said, I'm not saying that you should take Benadryl for sleep. People do, because the side effect of Benadryl is making you go to sleep. Okay, not the actual thing. Yeah, because it's a decongestant. That's what actually, what we use Benadryl for. But just be careful out there, because you're doubling up on medicine that you really don't need by combining those two things.
Okay, so what do you recommend if people really do have trouble? Because a lot of people just take that because, it helps me sleep better, but for those people who really can't go to sleep without any help.
I would consult your physician about your sleep patterns, because your sleep patterns really cause problems in your life. If you don't get enough sleep, you don't get enough restorative sleep, then you can get really ill. So we know that. But do not use those other medicines that combine. So just, if you're going to get some Benadryl, take it, but don't take the Benadryl plus Motrin. Okay. If you don't have pain.
The last thing we want to talk about, can treating hearing loss reduce the risk of dementia? We've often heard those two things are associated. Is that true? Can treating that help reduce dementia?
Yeah, we know that dementia, we have some studies now to show that hearing aids could help reduce the cognitive decline of dementia, because we think that if you are straining to hear a lot, then it puts an overstrain on your cognitive function, which means that you are having more decline in your cognitive function over time. So what we saw in the study of 130,000 people is that if you get a cochlear implant or a hearing aid, it slows the cognitive decline. So all folks between 65 and older, please, if you can't really hear very well, get a hearing aid. Don't just keep saying because it's going to cause you to start having cognitive decline. And when you correct it, increase in 3%. So please do that for the holidays.
All right, great stuff.
I got broken heart syndrome this morning.
I know. All right, Dr. Hebert visits us every Tuesday in the Eyewitness Morning News. If you've missed his previous updates, you can find them on our app, YouTube page, and our website, wwltv.com. All right, Peyton.